Hello, this is Alison Evans, the Nutrition Support Dietitian at Optum Infusion Pharmacy in Georgia. Today, I would like to present a case report on chronic metabolic acidosis-induced hypophosphatemia from topiramate. Topiramate is otherwise known as Topamax, used to control seizures, prevent migraines, and used in multiple sclerosis to control neuropathic pain and slow disability progression. A serious side effect of topiramate is metabolic acidosis, which is often unknown to the nutrition support clinician. Symptoms of metabolic acidosis may include fast breathing, nausea, and vomiting. Metabolic acidosis, if chronic, can lead to metabolic bone disease, calcium nephrolithiasis, and growth retardation. It can also induce renal wasting of phosphate. It's important to note clinical features of hypophosphatemia may include muscle weakness, respiratory failure, seizures, coma, rhabdomyolysis, and increased mortality. So we had a 30-year-old female with multiple sclerosis, autonomic dysfunction, gastroparesis, who was admitted for a GJ tube dislodgement. Subsequently, the tube was removed and patient was transitioned home on parenteral nutrition. Her oral medications included topiramate, gabapentin, Pepcid, to mention a few. At home, routine PN lab continued to show persistent chronic metabolic acidosis and mild hypophosphatemia, despite maximizing acetate salts in the PN, as well as providing supratherapeutic amounts of phosphorus. Despite efforts to correct these metabolic aberrations in the PN, the lab values improved, but they did not completely correct. The patient was eventually evaluated by a nephrologist who determined persistent metabolic acidosis was, in fact, topiramate induced. The topiramate dose was gradually reduced to 25 milligrams BID, which was the lowest effective dose without exacerbating the patient's symptoms. Acetate and phosphorus amounts were eventually able to be decreased in the home PN. Ongoing surveillance of patients' medications by the interdisciplinary team is critical to safely manage home PN patients. So to conclude, a thorough understanding of underlying pathophysiologic mechanisms of drug-induced metabolic aberrations is of vital importance to ensure safe home PN and prevention of any complications. Thank you for listening.